live. Welcome everyone to this webinar. I'm going to start presenting everyone first. My name is Jose. I'm the SCORP General Assistant. We have Jessica Zhang, who is the SCORP Director. Then we will have Maria. She is the program She's the program assistant coordinator. So then we will have Maya Fernando. She is the program coordinator for Dignifying and Non-Discriminatory Healthcare program. And then we will have Michael, Marian Sedlak, who is the liaison officer on human rights and peace issues. So we are starting with Jessica. And then we will go to Maria, to Maya, and finally to Michael.
Yes, thank you. So is my presentation on the full screen now?
Yes.
Okay, cool. Hi, everyone, and welcome to the webinar. I'm happy you're here. So Jose has already presented kind of the speakers, and it's the same as the agenda of the webinar. What we will do, we will end with a round of questions and answers. So you can write in the chat. It should be on the right-hand side of the video if you are online now. You can ask questions. If you're watching this later, then you can always approach us and ask questions, of course. But yeah, just let's get started. So first of all, I will address what human rights are. And the simple and maybe most accurate answer is, of course, that human rights are the rights that all humans should have, regardless of who they are or where they were born. I'm sure you know this already because you're here. And this is good, but it's kind of hard to work with because people have very different understanding and interpretation of this. So in an attempt to come to a common conclusion and some goals to work towards together, the Universal Declaration of Human Rights was created and adopted by the United Nations on the 10th of December in 1948. So this document is far from flawless, and there are many other different views and opinions on this. Nevertheless, the UDHR is probably the most well-known and widely accepted definition of human rights that we have in our time. So there are some principles for human rights, and these are that they are universal, so they apply to all humans everywhere. They are fundamental, meaning that they are the most basic things that we have. They are inalienable, they cannot be taken away from anyone. And they are indivisible, meaning that they are all interconnected to each other. And ensuring that all humans can access their rights is a prerequisite in order to reach equality and health equity. And it's also the responsibility of governments to ensure that human rights and the human rights of the people are being protected. So I was asked to talk a bit about common human rights violations. And well, I live in Sweden, and what do we know about Sweden? It's like a perfect country when it comes to human rights and equality, right? Or not really. But if you would have asked me in high school when I studied human rights, I would have said that, yeah, human rights are being violated in the world, and there are wars, and there is poverty and inequality, but it doesn't happen that much in Sweden or in Europe, maybe. But of course, that was wrong. And I guess that you've probably realized that human rights are being violated essentially everywhere in all countries. So in my opinion, one of the ugliest things about human rights violations, or one of the things that makes it so problematic, is that it tends to affect the most vulnerable people. So the people who the society might not listen to, and people who we might not always see. And sometimes we're also so used to these violations that we don't notice even when it happens right in front of us. And that's kind of the problem why it's hard to address and hard to maybe mobilize the support, because people don't see the problems unless it affects themselves. And even for us, who probably want to call ourselves human rights advocates, we miss it from time to time when it happens. So that's why if you want to advocate for human rights and equality, you will have to question what you see and what other people think. And you will have to learn or to practice to look deeper in everything around you, to analyze critically and be ready to challenge the norms. And when it comes to examples of human rights violations, well, in IFMSA, we like to target access to healthcare and issues related to discrimination, for example. But of course, all rights are being violated in some way somewhere in the world. And of course, since human rights are indivisible, they do affect each other. So I'm not going to try to give any more examples. We've tried to provide some on the Facebook group with the posts that we've made during the past week, and we will also collect everything in an email and share with you shortly, but you can check that out, or you can Google it and try to see what is relevant for your country and your region. So over to SCORP then. SCORP was funded in 1983, and back then the name was SCORE, and it stood for Senate Committee on Refugees. So the aim was to call attention to problems faced by displaced populations and to participate in relief efforts. Eventually, the members realized that these efforts were merely palliative, so they were treating the symptoms without addressing the root causes. And in order to work for more sustainable solutions, the committee decided that they also needed to target human rights violations and different threats to peace. And so SCORP became the SCORP that we know today. The vision of SCORP is a world where everyone has full and equal access to their human rights, and where everyone participates to help the most vulnerable people. In order to reach there, we do a lot of different activities. So, for example, we do awareness raising activities through different campaigns and events, both towards medical students as well as general public or other specific groups. And these activities aim to gather support for a certain issue to make people care and understand and see what is going on. For example, through this World Human Rights Day campaign that we're having now. And it's also done on a local level with flash mobs, demonstrations, posters, etc. A step in this could also be research activities, for example, gathering data on human rights violations or on perceptions on human rights, etc. And then we have capacity building. Capacity building is like one of our favorite words within IFMSA. And essentially, it's all about enhancing the capacity of the people. So equipping individuals with understanding, skills, and knowledge to take action and to work more efficiently. And we often do this through different workshops and trainings. One of the most important SCORP workshops is TNHIT, Training New Human Rights Trainers, where the participants will continue to build the capacity within their own communities after the workshop. At least that's the idea. Capacity building activities are often directed towards medical students through peer education methods, but they can also target other people and vulnerable groups, for example, children, migrants, etc., to empower these people to also protect and promote their own rights. Some other things that we tend to do is provision of services. So that would be direct support for vulnerable groups. For example, providing aid such as food, blankets, medical supplies, medical attention, etc. And this might in some way be more similar to the activities maybe that SCORP focused on back in the days when we were not SCORP but SCORE. And of course, these activities have a huge impact directly on the people supported by the actions, although it is in itself not an action protecting human rights, since, as we mentioned before, human rights should be protected by the government. However, this is a great way to increase awareness and build capacity, and it could also be used to empower the vulnerable groups to advocate for themselves. So although it might not be a long-term solution in itself in providing aid, it could be an important step on the way. And lastly, I want to mention advocacy. I've already mentioned it, but yeah. Advocacy is to actively support a cause and try to get others to support the same cause as well. It might target decision makers, so aiming to change policy or practice, or it can be aimed to change people's behaviors. And as you see, this would be a good way to create sustainable long-term change. However, advocacy is of course quite difficult and it takes a lot of time. So we try to work on advocacy on an international level, participating in external processes, etc., which I think Michael might tell you more about. But of course, advocacy is also done on a local level or a national level by the members. For example, by promoting, I don't know, improved legal access to healthcare for certain groups in society, and so on. But obviously, like normally, you don't just go to your minister and tell them what you want and you will get it. So it's important to know your stuff and practice your skills and to build public support, empower the vulnerable groups around you so that they can also make their voice heard, etc. So all of the above mentioned activities might also be like interconnected with this. And I also want to add that SCORP is, of course, not the only committee in IFMSA working on human rights. Since IFMSA works to promote health, better health for everyone, I would say that most of the work goes in line with this more or less directly. Only that we tend to have more of a human rights-based approach. So now over to focus areas. We don't have very well defined focus areas in particular because, as mentioned, human rights violations happen everywhere, and the main challenges might be quite different in different countries or different situations. We still discover new topics to cover every now and then, not the least depending on how the global situation changes and so on. But we do have some topics that we've explicitly said that we work on. And so far, these are vulnerable groups, especially refugees. So trying to look at inequalities and discrimination and so on. And then we have human rights and ethics and disasters. But these focus areas are also something that we aim to revise and maybe update during the term to see that it's in line with what members work on and what is happening in the world. And then lastly, let's take a look at our outreach. So here is a map showing the 122 countries that have member organizations in IFMSA. In total, IFMSA has 130 member organizations, also called NMOs. Out of these, around 75 are in some way active in SCORP. And we can have a look region by region. So Africa has 11 SCORP active NMOs. And the regional assistant for Africa for SCORP has reported that it can be kind of hard to work on human rights issues there because human rights can be seen as rather sensitive and controversial. So there's sometimes not that much knowledge on this, and the members cannot properly carry out their work. And then he mentions violations of political rights, such as freedom of speech, as a problem, as well as discrimination, gender-based violence, refugees, etc. And most of these are actually common challenges faced by all regions and NMOs. And then we have Americas. There are around 23 active NMOs in SCORP. And here, the lack of human rights education has been mentioned as a main issue. So the focus has often been to raise awareness and provide education in human rights for members as well as for others. But of course, there are also other activities, a lot of them as well. For example, on access to healthcare and disasters, refugees, discrimination, and so on. Then we have Asia Pacific, which has 14 NMOs in SCORP, most of them which are quite young, and it's a diverse region. Of course, all regions are diverse. But one topic which many of them are interested in is disaster risk reduction and disaster management, as many of these countries are located in areas quite prone to disasters. Also, many NMOs work on children and women's health and rights. And then we have the Eastern Mediterranean region with also 14 SCORP active NMOs, and there are only 14 NMOs in the region. And one of their main areas of work is refugees, and many of their successful projects also revolve around this topic. But they are also quite active in carrying out different campaigns to raise awareness and educate, whether at schools or universities and public places, etc. So, for example, reduce the stigma associated to disabilities and so on. And lastly, we have Europe, which has around 33 SCORP active NMOs. It's also the region with the biggest number of countries. So in Europe, refugees is also a priority, which has been agreed upon by the countries there. And many NMOs work on, for example, trying to include refugees and migrants in their society in a good way, like integration, those kind of things. But there are also a lot of advocacy activities on both national and regional level. And I think a nice example is that last year a statement was made on behalf of 20 NMOs from the European region, calling their government to create safe routes for refugees, increase resettlement places, and address their role in the root causes of unsafe migration. So SCORP has grown quite a lot in the past 2 years with many new active NMOs, and we've trained over 250 new human rights trainers across the world. We've had a lot of different workshops and sessions, and if you're an active social media user, especially if you're friends with other active Scorpions, you'll see that there are countless of activities carried out in different countries. So now you might ask, or maybe you should ask, like, hey, that's cool, but what impact do these activities actually have? And that's a good question. And honestly, I cannot really answer to that. So if you ask someone from a certain country what SCORP has contributed to and what impact we've had in the country, I'm sure that they would be able to name quite a few things. However, most activities have historically been known mostly to their member organizations, so within the country, and we have internationally not been able to properly collect and document everything that is being done. And thus, we have not been able to measure the impact. So in an attempt to solve this, IFMSA established the program structure around 2 years ago, and programs are great. And we're lucky today to have 2 people with us involved in IFMSA programs, so I feel that this is a good time to give the stage to Maria, the program support assistant.
Hello, everyone. I hope that you hear me clearly. My name is Maria, and I'm the program support assistant for VPA, as well as program coordinator for ethics and human rights and health. And I would like to talk with you today about what are IFMSA programs. So theoretically speaking, IFMSA programs are the centralized streams of the work done by NMOs in IFMSA International. However, in order to visualize it better, we can say that IFMSA programs are both umbrellas and platforms. Umbrellas because we're gathering people who are interested in a particular topic, a little bit more specific than the standing committee. So for example, SCORP is a very, as Jessica said previously, a very broad standing committee. When it comes to programs, we're focusing more on, for example, children's health and rights or medical ethics in particular. Apart from that, program coordinators also work with different standing committees in order to see what kind of broader perspective on this issue we may have. Apart from that, programs are platforms for you guys to showcase your activities internationally. So programs are being conducted and they're being coordinated by program coordinators who are helping you in developing your activities. And basically, you can enroll any activity that you have under the program. So we have multiple activities that you have in your NMOs. For our formal reasons, we divided them into 6 different groups. So as Jessica mentioned before, we may have education for specific groups. We may have advocacy efforts, also campaigning and research. Apart from that, we also can have fundraising for third parties, and operative work. So for example, providing service or any kind of possible help for other NGOs. So these are the programs, and what are the benefits that NMOs can gain from being enrolled under the program? First of all, promotion of the activities on an international level. So everything that you do, program coordinators are trying to all of your activities internationally. Better support opportunities from external partners as well as from the university authorities or other authorities. With IFMSA recognition, you can gather more support from the third parties, as well as you can cooperate with NMOs, other NMOs who are working on the same interest as you guys do. Apart from that, improvement of the impact of your activity within IFMSA support, and on how to plan and evaluate your activity better with the support of program coordinators. The impact report, which I'll talk about a little bit later, as a means to fundraise and increase your visibility. Apart from that, you can also participate in plenty of capacity building events that program coordinators are trying to work on throughout the year, as well as you are part of the community that works in a specialized field that you want to be a part of. Apart from that, last but not least, you can use the IFMSA logo in your promotional materials. So we have 5 SCORP-related programs that are very related to SCORP. We have Children's Health and Rights, works mostly on children's health and rights. Dignified and non-discriminatory healthcare, and I'm sure that Maya will talk about it in a moment as well. We have emergencies, disaster risk, and humanitarian action. Ethics in human rights and health, which I'm the program coordinator to, and mental health, which copes not only with the aspect of mental health, but also ending the stigma and human rights of people who are suffering from mental health issues. Apart from that, primarily we had also 2 programs that were related to SCORP in the very beginning. So gender-based violence and sexuality and gender identity. So we discussed what kind of activities you may have and what kind of activities you may enroll. So how to enroll it? You need to fill in 2 forms. One is the enrollment form and one is the candidature form. Enrollment form is a form that contains all of the information about your activity. So for example, what kind of activity is that? What is it all about? What are your objectives? What are the outcomes that you want to achieve? And how are you planning to evaluate and gather feedback from your activity? After that, you have to submit the candidature form. And this is basically the form that includes the name of your activity, the program that you want to enroll it to, and the stamp and signature of your NMO president and your signature. Afterwards, of course, you can enroll all of the activities that are not older than 1 year. Particular day. However, if you want to receive support from program coordinators on the implementation and the evaluation of your activity, you should submit the enrollment form and candidature form at least 4 weeks before the activity starts. And then program coordinators have 2 weeks to your enrollment form and to accept your activity under the program. They can also provide you guidance on how to make certain changes within the implementation and evaluation in order for your activity to fit into programs. And then after you get accepted, you get officially an email stating that you are accepted to the certain program. You need to fill in the report form after at least 4 weeks after the implementation of the activity. And lastly, I would like to speak a little bit about my perspective as being program coordinator. So program coordinators are the people who are coordinating the programs for you guys. And what are we doing is we are educating the members of the NMOs on not only how to enroll to programs, what is our program also about. We are conducting sessions in general assemblies and regional meetings, and we are helping in the campaigns such as the work that we are doing with Maya today during this webinar. Apart from that, we are facilitating and enabling the communication between NMOs who are working in specific areas. And we're holding the capacity building events. We are also collaborating with Executive Board of IFMSA and the TO on the work of standing committees as well as the advocacy committee. Okay, and we also have some certain tasks that we need to do throughout the year. Just to briefly say what we have to do as program coordinators. So in the first term of our work, we had to conduct the baseline assessments. So we had to check out what are the needs of the NMOs and what do NMOs work on. So we were reviewing all of the NMO reports, all of the data that we collected throughout two years implementation in order to see what do NMOs actually do and how does it relate to our program according to the program proposal. After we conducted the baseline assessment, we started the enrollment of the activities. So starting from last year, you can enroll everything that you are doing in your NMOs to the programs. We have 18 programs for now. All of the program coordinators are the members of your NMOs, and they are firstly doing an annual working plan. So they are preparing all of the work that they would like to conduct throughout the year. And afterwards, they are, of course, accepting the activities and implementing the program impact report. As I said before, program impact report is a way for not only for IFMSA to measure impact, but also for you to increase your visibility as well as to have one of the means to fundraise. Because in program impact reports, program coordinators are including all of the efforts from all of the NMOs who are working in the particular program field throughout the year. And all of the information from you are being included within this report. So you can use it afterwards, after the August meeting, as a means to fundraise in the future. What else do we do? We also, as I mentioned before, are conducting sessions during GAs and regional meetings to hold some capacity building events and help standing committees and NMOs to implement better activities for IFMSA and for your NMOs. So that's it from my part. Thank you.
And then it's my turn. My name is Maya. I am the program coordinator on dignifying and non-discriminatory healthcare. And I'd like to talk to you a little bit about the examples of, or how it's related to human rights. So the program on dignifying and non-discriminatory healthcare is enrolling activities that are aimed to ensure access to health for all individuals, regardless of their nationality, age, sex, socioeconomic standing, ethnicity, religion, ability, migrational, or any other status. And as this is a part of the World Human Rights Day campaign, I would like to explain this from the perspective of human rights. And human rights are, of course, rights we have simply because we are human, and they are regulated in several documents, as Jessica mentioned. And one of the rights that we are mainly working on is the right to health. And the right to health is more than just the right to health care. For a person to enjoy the highest attainable standard of health, they also need food, clean water and sanitation, fair working conditions, etc. And this is how the human rights are indivisible. They are connected to each other. Now, the right to health is regulated in Article 12 in the International Covenant on Economic, Social, and Cultural Rights, which is one of these documents. It states that everyone has the right to the enjoyment of the highest attainable standard of physical and mental health. And for this to be fully realized, states need to work in a lot of areas, including creating conditions which would assure to all medical service and medical attention in the event of sickness. Now, I'm sure most of you would agree that this is not fully realized in your country. I know it is not in mine. And the main issue here is the to all part. Just as Jessica mentioned, it is often vulnerable groups who are affected by human rights violations. And therefore, there has also been several conventions on the human rights of vulnerable groups. And in these, the right to health is specifically stated in some of them, as this has been a common violations. The program on dignifying and non-discriminatory healthcare works on promoting health among different vulnerable groups. So ensuring this, one way of understanding how the Article 12 should be interpreted is the AAAQ. And the program is mainly involved in promoting accessibility and acceptability. A dignifying and non-discriminatory health service is one that is accessible for all, including vulnerable groups, and culturally acceptable with consideration for cultural beliefs among minorities. If a health service does not take into consideration the cultural and religious beliefs among minorities, the health service is not truly accessible for all. And also, the main problem in accessibility is discrimination, which can be in society or in institution or in the workplace itself among healthcare workers. And some examples of issues are restricted access to healthcare for migrants, ethnic minorities, persons with disabilities, and others. There has been a strong connection in SCORP on working with refugees and the access to health for this group. And also, as I mentioned, institutional discrimination against these groups. And activities working on these causes can work in different ways. So we already mentioned capacity building. There are many workshops and campaigns aimed to equip healthcare students with knowledge on these issues and tools on how to work with it, how to start projects of their own. And also, if they are not, if they don't become active in a project, these capacity building events will also ensure a more knowledgeable and aware future healthcare workforce. And there is also student initiatives to actively try to change legislation, working on advocacy. As Jessica mentioned, there are several NMOs working on trying to change the legislation when it comes to access to healthcare for groups who are denied access due to their migration status, such as undocumented migrants. Other activities include improving living conditions for vulnerable groups, guiding to health services, giving information on how the healthcare system works, providing translators, giving transportation to hospital and other needs that the vulnerable group could have. Also, improving the inclusiveness of the healthcare. This could be done by research where indicators collected from activities could be used in advocacy. And of course, raising awareness campaigns aimed at the public, aimed at the healthcare workers or their institutions, or aimed at healthcare students. These are some of the examples of activities that could be enrolled in the program. And as Maria mentioned, there are many benefits of enrolling your activity. And if you have any questions, you can contact me on this email. And yeah, I think that was it that I wanted to say.
Thank you very much, Maya. I guess it's my turn right now. So I would like to introduce myself to you. My name is Marian Majko-Sedlak. I am liaison officer for human rights and peace issues, and I'm coming from Slomsa, Slovakia. And I will talk to you about a bit of our external relations and advocacy, and generally our activities, not internal ones, in human rights and peace issues. So I would like to share my screen with you. I have prepared a short presentation for you. So let's see if it will work. Yes, so you can see my screen right now. Okay, awesome. So let's talk about external relations and advocacy. So the very important concept which we need to understand is that as IFMSA, as international federation who is gathering 130 national member organizations from more than 122 states, is a really powerful entity. As federation, we have really unique opportunity to influence decision taken at all levels, global levels, regional levels, national level, local levels. So we can easily reach out to organizations on the global level and then spread down like on the pyramid or spider web to local impact. So, and I think also Jessica mentioned during her presentation that usually when you want to change the things from up to down approach, you just don't go to the ministries of healthcare and you just don't ask for something, because then all of the people can do something like that. Far-right groups can do things like that. So this doesn't work like this. But if we, like the federation alone, we can change things, but we have a really greater potential if we are partnering, collaborating with other organizations, similar organizations in the same field. We are joining our efforts, we are joining our sources, activities, and then we go together and to advocate. We are advocating together. So I'll just make sure that you see me. Okay, it's working. Okay, so let's go to our first slide. So IFMSA as external representation, since we are representing more than 1.3 million of medical students all around the world, this is really huge group. And also like the focus fields of IFMSA are really broad, and we needed to somehow come up with unified strategy, how to streamline our external representation, how to make it more transparent for NMOs, how to make NMOs feeling, how make NMOs more involved, how to make them more involved in our external representations activities. So that's why the group of liaison officers and vice president for external activities proposed a system of global external focus areas. This is a strategy for the IFMSA. In simple words, to explain it, it would be like to show IFMSA liaison officers and respective team of officials members to which external meetings to go to which external meetings or processes submit statements to which external meetings, conferences to submit abstracts to, and just to streamline our external representation, make clear points for us to what focus fields should we focus and work on. So that's why we have created, I think there are 7 global external focus areas and 3 overreaching concepts. So at first I would like to introduce you those overreaching concepts. So as IFMSA, we work on many issues which are somehow and sometimes cross-cut each other, but they are all important to IFMSA regardless of which particular topics we discuss. We have 3 overreaching concepts. The first is health in all policies. So when we are discussing all other issues, let's say politics, let's say transportation, let's say sustainable housing, let's say anything climate change, we always want to incorporate health in those policies, in those issues, because health is somehow connected with all other things we are doing. The second one is meaningful youth participation. So we always want to involve young people in all levels of decision-making processes and involve them actively and meaningfully. So not to be just the passive bystanders of processes, but to really actively give input and to provide our suggestions and solutions. And the third one is sustainable health workforce. So we need to have a sustainability, we need to have a continuation in the health workforce globally. So that's why we also want to advocate for strengthening and making those health systems more resilient. So those are 3 overarching concepts. And right now, let's go to focus fields, those global external focus areas, 7 particular one. So you can see them in this slide. So mainly, you have the first 2 are SCORP-related, human rights and peace-related issues, which is humanitarian action and refugees and migrants' rights and health. And then we have non-communicable diseases, social accountability in medical schools, primary health care, climate change and health, and sexual and reproductive health and rights. So those focus fields serve us as something like a mantra, something like a template on which let's say, issues, areas should we focus on in our external representation and advocacy efforts, and to what meetings should we go, what statements should we submit, and generally in what fields should we be active. As you will see, we have only, for now, we have only 2 focus fields connected to human rights and peace issues, but you will see they are much more complicated, much more detailed, and you will also see how we can work also on things which are not included in those focus fields. So right now, I would like to go to a particular focus field named humanitarian action. So under this huge area, we have many things included. So from disasters with risk reduction, from disaster risk management, through things around international human rights law, international humanitarian law, humanitarian and development aid, vulnerable groups in humanitarian settings. All those things are included under the umbrella of humanitarian action. I'm not sure if you are able to see, because like there is a document called Global External Focus Areas, which is shared with national member organizations, mostly with presidents, vice presidents, but they should also spread this document to national officers, local officers, and members. And for each of those global external focus areas, we have a set of goals, aims, which we want to achieve during this year in this particular area, then set of actions and set of indicators. So we precisely planned what we want to achieve in those areas, and we have all the objectives, the steps, how to get there, and also action points, how we will actually start to work on those things. So in this particular humanitarian action area, we have 5 goals, if I'm not mistaken. You can check them later. I will share the link with you. This is not important for us right now. The important thing to say and to outline is how we are working in these GFAS and in these areas. What had we already done and what are we planning to do? So I have selected some of the most important international processes connected to issues in these global areas. So humanitarian action area, I'm not sure if you heard about the initiative called World Humanitarian Summit. This was the process which was being active during 2 years in the preparations phase. Right now we are in follow-up phase, and okay, I will get back to this later. So during the last year, IFMSA was actively participating in the preparations for the World Humanitarian Summit, which itself happened in Istanbul in May, 22nd May, I think, if I'm not mistaken, during this year. And we have been really active in all the preparations. We have attended a global youth consultation in Doha, where the people from World Humanitarian Summit Secretary asked young people for their input and their opinion about how should global humanitarian sphere and area should be changed for future years. Because we know that humanitarian landscape is shifting and changing. We have many problems there, and that's why we need some reforms to make it more effective, to reach to all people, to leave no one behind. Summit was created and was conducted. So we, as IFMSA, have actively participated in this. And as for the outcomes, how we are active in the follow-up process, I would like to point out 2 things. The first thing is the page you can see there in the presentations, agendaforhumanity.org. Why this is important? During this World Humanitarian Summit, many stakeholders, different stakeholders from governments, through private sectors, through international organizations, through civil society organizations, they made pledges, kind of like promises, when they promised to start to work on certain issues connected to humanitarian field. In this page, www.agendaforhumanity.org, you can search for those promises, search for those pledges, and you can filter them according to country, according to organization, according to many other factors. So why this is useful? let's say from my country, from Slovakia, I can go to this page, Agenda for Humanity. I can try to look for Slovakia, and I can see what Slovakia as the state promised to do to improve humanitarian action all around the world. Then I can go through these promises to those pledges, and I can see, oh, for example, Slovakia promised to create 500 places for refugee students to come to our country. And then we can start actively working on this. We can try to write statements. We can try to make a position of our national organization and try to advocate for it. Try to ask your country or the organization or whoever actor, stakeholder is there, what have you done to achieve those things which you promised? And this is really important. And this is the thing all people around the world or Scorpions can do in cooperation with their local and national organizations. We can ask for accountability. We can ask for concrete measures countries and other stakeholders already took or are planning to take to improve world humanitarian landscape and area. So this is the first thing, which is really important for us. The second thing is the initiative called Compact for Young People in Humanitarian Action. During this World Humanitarian Summit, it was really emphasized that youth and young people usually seen as victims of disasters and conflicts and humanitarian crises. But it is not acknowledged enough that young people can be also active contributors to change. They can actively participate in prevention efforts, relief efforts. They can be active. They can act as people of change and people of action, and that's why we people under initiative of Compact, they created a document, 2-page document, which outlines 5 core fields. How can youth all around the world be supported in order to take active involvement, to be actively and meaningfully involved in humanitarian action? So the first action, it goes from service delivery through participation and capacity and local action resources and data knowledge. IFMSA as the organization is member of Compact for Young People in Humanitarian Action, also with other organizations like International Federation of the Red Cross and Red Crescent societies, several UN agencies, and other youth organizations. Also some countries are there. And we are trying to actively follow up on this process. Right now, IFMSA is being actively involved in the follow-up because in the whole process of Compact, the Compact created task forces to work on specific issues within the Compact surroundings. So, and right now we as IFMSA are active in 2 specific areas. The first one is, I have to check it out. Yes, the first one is engagement and participation with young people, and the second one is capacity development within the Compact members. So we are trying to be actively involved also in this field as IFMSA. I guess this is about humanitarian action. Of course, like the time is limited, I can't talk much about other activities, but we are doing a lot. And if you are interested in anything I'm mentioning here, just write me an email. And let's jump off to the second external focus area, which is refugees and migrants' rights and health. So again, also in this field, we have a little bit less action points and goals, only 3, but this doesn't mean that this is less important for us as a humanitarian action. So which is really great for this particular area is that in March meeting 2016, IFMSA has adopted policy statement on refugees and asylum seekers' rights and health, which is important to mention because there is a difference between them. But why this is useful for? So we haven't said that IFMSA as the international organizations, we need to have stances on topics we are interested in to work in the global arena. So, and those are called policy statements. Those are statements of the federation when national member organizations agree on certain topics and certain stands on some issue. And then we are able to say that, hey, IFMSA has a policy statement on refugees and asylum seekers' rights and health, and we are representing 1.3 million of medical students who thinks this. And we have a document, and we have a set of actions which we are asking from different stakeholders to do, and we are able to meaningfully engage in global processes. So we are generally advocating under this area for full access to rights and healthcare of refugees and asylum seekers and migrants. And some important things which happened around this field during this year is that for the first time, United Nations General Assembly hosted a summit, high-level summit on refugees and migrants. It happened on 19th of September in New York City. IFMSA was there. I was representing IFMSA. And when it comes to follow-up from this summit, okay, there was a New York Declaration on Refugees and Migrants, which was adopted during this summit. But usually declarations are just statements on which further actions are built. And on this declaration, the process of creating global compact on refugees and migrants, well, two compacts, one of migration and one of refugees, is being created right now, trying to find effective avenues and ways how IFMSA can be involved meaningfully in this process. Because right now, the recent update is that by 31st of January next year, modalities for the involvement of civil society organizations and the whole design of this process of creation, those compacts, should be made, and we are trying to find out how can we as IFMSA be there, be actively involved, and put input and share our views on refugees and migrants and their rights and health. So just like interesting thing, this whole process leading up to the compact is coordinated by two countries, Mexico and Switzerland, and their permanent missions to the United Nations. So interesting information. And well, when it comes to also some concrete steps, as Jessica mentioned, we are also working on the regional levels in human rights and peace issues. And during this year, especially European region has refugees and migrants' health and rights as the regional priority. So we are trying to actively work in the region with NMOs, with the regional representatives, to create a regional strategy on advocacy for refugees and asylum seekers' rights and health. And when it comes to concrete cooperations with the external organizations in this field, well, this is quite more difficult as in humanitarian action, because we do not have so many partners in this field, but we are trying to actively reach out to several organizations working in this field, especially with healthcare issues. Because the whole field of refugees, asylum seekers, migrants' rights and health is really huge, really broad, and we can't work in this area, in this whole area, because this is too broad for us. We are trying to focus on health and access to healthcare. So we are trying to actively reach out to organizations who are working especially with health and healthcare on the policy level, on advocacy level, but also in humanitarian level, like concrete humanitarian work and action. Things we have already done, maybe you know the UNRWA, which is UNRWA. It stands for United Nations Reliefs and Works Agency for Palestinian Refugees. We have a long-standing cooperation with this UN agency, and each and every year we are trying to provide IFMSA students internships in this organization. And also this year, we already had a call for internships. I will try to do the call also for the next year. And we are also trying to work with UNRWA on cooperation during external meetings, for example, World Health Assembly, and we are trying to also push for the agenda of refugees and migrants also through external meetings. The second organization which is really active in this field is the WHO, which stands for World Health Organization, which is UN agency mandated to do actions around global health and to be actively involved. And to connect also countries and other organizations under them. So they're also trying to be in contact with WHO Department on Migrants' Health. We are trying to be actively involved in the update process for the WHO resolution on migration health. But this is kind of complicated also, but we are trying to get there. And we are also trying to get to some possibilities of internships there, to attend their conferences and to be more meaningfully involved with them. So I think for refugees and migrants' rights and health, this is all for now. Of course we have also other collaborations with organizations, but since I should end, because I think I used more than the time which was allocated to me. I just have one last slide to show you that we are not only working in those two GFAs as are outlined in this concept. So for example, this also kind of falls under the humanitarian action, but we have extensive collaboration with International Committee of the Red Cross and their initiative Healthcare in Danger. You were able to see a lot of posts recently, because we have also signed the Memorandum of Understanding with the International Committee of the Red Cross on the 1st of December. So right now we foster this collaboration we have for many years, and we'll try to get internships in ICRC. Then we also are trying to start to work on children's rights and health, also in the external area, because we have also many projects working with this topic within SCORP, but also within SCOF. Being active in peace and peace building activities together with meaningful youth participation and the Security Council Resolution 2250 on youth, peace and security. But this is something we are just starting right now, and I know this concept is really broad and theoretical for now, so I do not want to tell you more information for now. And we are also trying to be active in the field of medical ethics. UNESCO and their annual conference on bioethics and medical ethics. So you were able to also see the calls for a delegation we already had a few weeks ago, and we will attend the conference in March in Cyprus in this field. Awesome. So I think for now this is all connected to external representation and advocacy. So if you have any questions connected to my topic, just feel free to write them into the chat next to the screen, and I will be happy to also reply to your emails. Okay, so I think I'm done here right now, so I'm passing my word back to Jessica or Jose.
So thank you all for your interventions and your speeches. They were great, and I think we can go into the comments. There's one comment, I guess. Yamis, I guess, says that she wishes that we could put more work into action in regards to refugees' rights and health. And IFMSA should make a prominent appearance and have more support from international organizations. What can you say more? Can you tell more about this, Michael?
Yes, I definitely agree with that. The only issue or a challenge which we have is, as I mentioned, during the last year, we didn't have a policy statement on refugees and asylum seekers. And for us as the international organization, we can only do our advocacy based on the policy statements we have. Because I will just explain in a simplified way. For example, we have 1.3 million of medical students in the Federation, and all of them can just come and say that, for example, my stance on refugees' access to health is like this. But this doesn't represent the whole Federation. This doesn't represent only the one particular person. So that's why we need to adopt policy statements. We actually did during this year. So that's the thing why we just started to be really actively involved in the global field and advocacy field around refugees and migrants. And for this, we also need to build the connections to those organizations. So right now we are trying to actively reach out, to make bonds, make partnerships, to see, to explore opportunities where we can partner with those organizations. And then we can also start to work more, I would say, on the eyes of the public. Because right now, the majority of this work is in background, in behind. And then I think when it will come to concrete steps in some international processes, as for example, I mentioned the International Compact on Migration, where we can be active, we will, I think it will be more visible what we are doing right now. Because also when it comes to appearance is usually done by campaigning, or campaigning connected to advocacy, not so much lobbying, because lobbying is usually connected with governments and to influence decision-making processes. But we already had, for example, one huge campaign related to WHO regional meeting in Europe. I'm not sure about the name of this campaign right now, but it was something about creating safe passage for refugees coming to Europe. But this was also only regionally oriented. And also when it comes to refugees and migrants all around the world, the problem is that those crises which are all around the world, for example, in Eastern Mediterranean regions, refugees coming from Syria and Iraq to Europe. Then we have also the second front, refugees coming from African countries through Libya to Europe. Then we have also issues in Americas. Then we have issues in Southern Asia, Australia. Sometimes to develop a unified concept is really, really difficult, because to gather all those things and all those different features under one strategy, it's really hard. That's why we also try to promote advocacy on the regional levels, to try to reach out to the regions, because those issues are really sometimes regionally specific, and different actions and different measures can be effective in different regions. So also that's the problem. But also, like, I completely agree with you that we should do more, and we are trying to do our best, and we will see like where our steps will go during the next weeks and next months.
So, thank you, Michael. And she, Yamis also added that she has worked with Syrian refugees in several medical missions, and she couldn't get the support she was looking for from the UNRWA and WHO. And she says exactly more internships are needed.
Yeah.
So
exactly, like I definitely agree with the internships, and we are trying to do. If everything will go well for UNRWA during this year, we will have the biggest number of interns there. But the call was already out in summer, September, October, so that's like passé for now. But when it comes to field work, this is kind of problematic because since those international organizations, I'm telling about international organizations from the UN framework, they are usually much like not so happy when medical students who are not trained, they are not doctors, that do not have proper knowledge, even like although they are trained by some IFMSA activities or trained by externals, they do not like them to participate in the field work because also when you will be a doctor, also those organizations like International Red Cross, Red Crescent, or Doctors Without Borders, and all other organizations who are working in this field, they usually have high requirements for those people who are entering field missions. They usually require a few years of experience working in clinical settings, and then you are able to go there. Because it's also dangerous, on the one hand, and they usually also need to be covered when something, for example, something bad will happen, and you are not a medical doctor, you are just only a student. So this is problematic sometimes. But where we have a huge possibility to work in is the field work, but not concretely working in, let's say, health provision of healthcare, but for example, data work or some helping, let's say, helping work in refugee camps or along the roads. And this is something which needs to be explored, but also the stance of some organizations is not so welcoming. Again, we are trying to do our best. But the condition is that we need to have medical students who are skilled and trained. That's why our internal work, for example, all those workshops like TNHRT, Advanced Human Rights, international training of disaster medicine, it's really important for us to spread them, to build a capacity within medical students, also on the regional level, national level, and local levels, when we can build the workforce of medical students, and then we can approach those organizations and tell them like, hey, we have hundreds of medical students who are skilled, they are able to do that, they are able to go there, work there, so we need to achieve this stage. And when we will have this, one step further.
Thank you, Michael. Does any of the speakers have anything further to add? We can start by Maya. Do you? Or Maria? No? What about you, Michael? Do you have anything else to add?
Going through questions, like I just would like to tell all the people that, like, do not hesitate to ask any questions, even if you think that they are basic or they are relating to subjects which were already told during this webinar, because all questions are really valuable. I'm just going. I can't see any other questions.
I can try to summarize what we've been talking about while you guys listening can think of questions that you might want to ask to any of the speakers. So we've tried to cover a bit basics of human rights and the work of SCORP and IFMSA when it comes to human rights different activities. Then we've talked about what it looks like in the different regions where SCORP is active. We have heard more about how the program structure works, what was the idea behind it, as well as the benefits of enrolling your activities in the programs, how you use the programs, etc. And then we've heard a bit more about one of the programs, Dignifying and Non-Discriminatory Healthcare, what activities can enroll there and what the rationale is. And then we've ended with the external work with the global external focus areas and the work that IFMSA is doing. And yes, we will share the presentations with you, and you will get our email addresses and the links. And I hope that you've all subscribed to the SCORP server, because we will share it there. I will write in the chat box how you subscribe to the SCORP survey if you haven't done that yet. You send an empty email to IFMSA SCORP subscribe at yahoogroups.com. Oops. Okay, I cannot send it, it says. But anyways, so IFMSA, and then what is this line called? SCORP at, I'm just going to write it in the PowerPoint. Just a second.
Meanwhile, can I just add one more thing? I just thought about one thing. Okay, I'll just go back to that thing on collaboration on the national level. So as Lamis asked, that you looked for UNRWA and WHO for support. And this is also a kind of important thing, that we are collaborating with those institutions on the international level as the IFMSA, but your national member organizations and local organizations, if you have, are members of IFMSA, but when it comes to external partnerships and collaborations, they are kind of like independent. So for example, you, as the national member organization, you can also reach out to the same organization on the national level. For example, when talking about WHO, let's say WHO office of that particular country, and you can ask them, just approach them that say that you are members of IFMSA, and IFMSA has institutional partnerships with those organizations on the international level. And you can approach them and you can ask them if it's possible to also make something like a collaboration on the national level, on behalf of the national member organization and on behalf of the national office of that particular organization. Then you can also achieve like more close cooperation, more fostered cooperation, and you can work on the issues which are pertinent in your country and in your surroundings. Because this is also what we are trying to promote by those international partnerships. And I haven't mentioned it when talking about the International Committee of the Red Cross and Healthcare in Danger Initiative. But we have, for example, we have partnerships on the international level, but we are trying to ask national member organizations who are trying to conduct trainings around the field of healthcare in danger to send the proposal to us, and then we can ensure that the international healthcare in danger project can support the work in the national organization, can support the workshop, and we can utilize those international partnerships for the work on the national level, which is really amazing, I think. So, but also, like, if you would like to do something like that on the national level, you need to contact your national member organization to like tell them your idea, and then they will probably contact us and we will provide them guidance how to do it. But this is something which is possible, which is needed, and which would be good. So.
Thank you, Michael.
Yeah, I was also thinking about it. So actually, when it comes to national collaboration, it's something that you can also work with your regional assistants, and we can try to provide support. And it's not as much influenced by the GFAs and those kind of things that we were previously talking about, I suppose. And I've finally managed to get the email address out. So send an empty email to IFMSA SCORP subscribe at yahoogroups.com to subscribe to the email server. We will share the presentations there as well as other information relevant to SCORP. And also here are our contact details of all the speakers. So you can always email us if you have any questions, if you want to know more about any topic in particular, or so, as well as you can also comment in the Facebook posts. I suppose you might have seen the posts on Facebook where we've tried to promote, oh, my computer, where we've tried to promote this event. So you can just write a comment there and we will see it as well. And I think we have another comment. It goes, I know you have already talked about, but as you know, in the high-income countries, there are many organizations offering volunteer work in low-income countries, paying an amount of money. Is there any specific question you want to ask in relation to this? In the meantime, the rest of you can keep on thinking of other questions that you might want to ask. And also, so starting to wrap up a little bit, this is our first webinar as this SCORP international team. It's also the first webinar ever that I've done, so it was fun. And we would love to hear your feedback, how you liked it, and if it was informative, and if there is anything else you would like us to do, anything you want to hear more about, future webinars, any ways to improve it, etc. So you can just write it in the comment box, or as previously mentioned, you can send us an email. You can send me an email or comment on Facebook, and we will try to take that into consideration, because we do plan on creating more webinars, because we're thinking that it might be a good way to reach more people, especially maybe members who are not able to attend like general assemblies and so on. So we would love to hear your feedback. Okay, so the continuation of the question goes, what do you think about this? Is it necessary for people to pay when volunteering or to travel to a country with no previous training? I could give my personal opinion on that if you want to hear. So this is actually nothing that SCORP has in particular discussed, or that IFMSA has a stance on as such. But I know what you're talking about. There are many organizations sending volunteers across the world. And although, of course, especially I think most of the volunteers have good intentions, and I'm sure it can have good impact as well. This is quite, it can be a bit sensitive, especially when people are sent without previous training. They have good intentions, but they might not be able to carry out the tasks as they are supposed to carry out. And that might be more, not so much a benefit of the local community. It can, on the other hand, rather harm the local community, the local economy, and the things that are being done there. So, so although it doesn't necessarily have to be bad, I think it's something, if someone wants to do this, they would have to consider very closely, look at their skills. Do they have the skills needed to carry out the tasks for this position? Is this a task that they can carry out in their home country? And also in the organization, like, is this really a trustable organization that do this to help the community, or are they making a profit off it? Because quite often these kind of trips, it's more like volunteerism rather than volunteering. So it's for people to travel and have fun and, you know, get some new experiences, and the companies can also earn money on that. So it's like that. And yeah. So if anyone else has anything to add, please do.
I just wanted to thank you all for being here in the first webinar, and all the participants that are watching us from all over the world. Thank you all. So.
Yeah.
And when talking, because Jessica, you also mentioned that we are planning to do more webinars. For now, I can already tell that speaking about external representation, we'll have 2 separate webinars on each of our GFAS, Global External Focus Areas. So one will be about refugees and migrants, health and rights, and the second one will be on humanitarian action. And they will be quite detailed, because it will be one webinar on the particular GFA for 1 hour, 1.5 hours. So if you're interested in those things, like, feel free to attend. They will probably be conducted or organized April and June, I think, if I'm not mistaken, but you will be informed about that through emails, as Jessica wrote you that address, how to join SCORP server. So it will be announced that, so don't worry, you will not miss it if you are interested.
Okay, I think that was all in that case for us. I also just want to say thank you for participating, and I hope to see you again another time, whether online or preferably in real life. So have a nice Sunday afternoon or morning, depending on your region.
Yes, have a nice rest of the day, and thank you very much for coming.
Thank you.
Bye.
Goodbye. Bye-bye.